If you have a kid who doesn't want to communicate with anybody in school, refuses to interact, to take tests or anything, yet when comes home will talk to the mother and the father. It's such a condition really exists.
Yes, it's obviously called selective mutism. Years ago, it was initially diagnosed, they called it elective mutism, assuming that the child was doing it intentionally to be contrary and rebellious, so they wouldn't talk to authority figures, like their teachers especially. They might, in the classrooms, have one or two or three kids they talk to, and those kids even communicate for them. They tell the teacher, well, he really wants you to do this, or he says the answer is this. They will be very comfortable at home usually. They'll usually talk to anybody in their household. However, if a more distant relative comes in, say an uncle who's in from out of town, hasn't seen the uncle, probably maybe never met the uncle, suddenly, even in the presence of their family, they will basically become mute.
If the kid refuses to perform in school for whatever the reason, but saying selective mutism, are those kids, I don't say it's the ideal thing, better homeschooled or schooled with other children they're not comfortable with?
No, it's much better to keep them in the regular school system, because obviously if you homeschool that kid, they're going to become very comfortable with that one or two teachers that come in during the week to teach them, or if the parents do the homeschooling. Usually what will happen is, as they go on, first grade, it usually manifests itself at around the age of 4 or 5. That's when it becomes noticeable. First grade, especially first grade, where the teacher's calling on kids to talk and give answers. If that child is kept in the regular schools, and quote inclusive, usually by the second, third, fourth grade, they're going to start generalizing who they talk to. And usually by the fifth or sixth grade, they're going to be talking to their teachers and such. So I always encourage parents, don't feel so despairing about it.
If the teacher, because a kid refuses to interact or do a test, starts saying, oh, there must be something mentally wrong, developmental delay, the teacher really should sit down with the parents and maybe psychologist or the pediatrician and talk that this is not a kid that can't function. The kid is refusing to function. That is different. And you have to approach that in a completely different way than a kid that doesn't have the ability. Is that correct?
You're spot on. In fact, that's why about 10 years ago they did change the diagnosis from elective mutism, where the idea is the child was choosing to not participate or refusing to participate, to being selective, meaning they're not electing to do it, but in some situations the anxiety is so intense when these children that they literally can't speak. And these kids are usually, as they go on, and I mentioned in the upper grade schools and elementary, in the upper grades, they do start to become more social, but they're always going to be shy relative to the other children. And they're also, 90% of the time, they're going to be what's called in adulthood socially anxious. They're going to have a social anxiety disorder, meaning they're not comfortable in groups, they hate crowds, they certainly don't, if they're at a party or anything, they basically stay in the background. They hate attention being called to them.
But a parent should reach out to the school, reach out all the caretakers, and address it so the teacher should understand this is not a kid that has a developmental brain problem. It's an emotional problem, and there are ways it can be improved upon. But the worst thing to do is label the kid having a developmental or an intellectual handicap.
Yes, these poor kids are really very terrified. And one of the worst things a teacher can do is, whether the teacher thinks it's a refusal, that the child's being oppositional or defiant, or just thinks they're going to help the child by putting them on the spot. Almost like, there's a technique in psychology that has basically been proven not to be very effective, called flooding, where you put the person in their worst nightmare, their worst fear, and the idea is they're going to become acclimated to it. So there are teachers who, again, whether it's out of ignorance or they think they're helping, they'll give the kid a part in a play. Worst thing you can do. What you're doing is you're setting the kid up to fail. They're going to get traumatized, and now you're going to add, on top of the anxiety disorder, they're going to have a post-traumatic stress situation.